Food Safety and Quality Network. Today's presentation is FDA Intentional Adulteration Inspections, what to expect and how to prepare. And that's with Earl Arnold from Aib International. Yes, say hello, tell us where you're joining us from today in the sidebar. It's nice to have you all along. It is being recorded today, as always, after the event today. About an hour or so after, we'll send a follow-up email, and that'll include the slides, the recording, and your certificate of attendance. Yeah, as you know, Food Safety Fridays is sponsored. One of our sponsors is Aib International, and I'll play their sponsors video ads now, and then I'll be back in 2 minutes and we'll meet Earl.
The world of food has changed a lot in the last 100 years. But one thing that doesn't change? Ensuring the quality and safe handling of food. No matter what changes are yet to come, we're proud to always be on our clients' side, shaping the future of food, today and tomorrow. Aib International, ever onward.
Okay, time to meet Earl. Are you there, Earl? Switch your webcam on. Oh, mine's gone off. Are you there? Are you there, Earl?
I am. There we go.
There
we go.
Nice to see you, Earl. Back again for another one. Always enjoy your presentations.
Thank you, Simon, and I'm very happy to be here. Excited as always.
Right, do you want to just tell the audience where you're calling in from? We always like to know where you're joining us from.
Yeah, sure. I'm calling in from Austin, Texas. It's been rainy for the last few days here.
Right, and I'm, as you know, I think the regulars know, I'm in rainy Manchester. It always rains in Manchester. Okay, so I'll be back for the Q&A and to assist with the polls, but I'll leave it to you now, Earl.
Okay. There we go. All right, so ladies and gentlemen, thank you for attending this webinar. I really appreciate the opportunity to come and chat with you a little bit about intentional adulteration. What we're going to be discussing is FDA's intentional adulteration inspections, what to expect and how to prepare. But before we begin, I'd like to provide you with a brief summary of who we at Aib International is. First, we are passionate food experts. We are always ready to get the job done and put our extensive knowledge to work for our clients. We positively impact the food supply chain by serving as partners to our clients to turn our insights into action. And finally, we combine 100 years of industry expertise with a deep understanding of our clients' challenges and ambitions. We not only share our clients' commitment to food safety and quality, we help them raise the standard. By supporting the delivery of safe, high-quality food every day, our clients are able to deliver the best possible products today and tomorrow, and in doing so, we ensure the enjoyment of food for everyone. So this is the agenda of what we're going to cover for today's presentation. We're going to discuss how to prepare for these early inspections, and we're going to do a quick brief overview of the regulatory requirements. We're going to talk about the different types of potential vulnerability assessments and mitigation strategies, and the training that may be required for qualified individuals, or how you can be considered a qualified individual. We're also going to discuss updated information from FDA on draft guidance just a little bit, and we're going to discuss best practices, tips, and ways to meet the expectations that are coming up. And as a reminder, in April of last year, FDA, when they had a discussion, a town forum, they had mentioned that they were not going to extend compliance dates for this new rule, but they were going to suspend and not conduct inspections on the intentional adulteration regulation until March of this year, 2020. Keeping that in mind, we're going to use this as what may happen when FDA starts in March of 2020. During that town hall meeting, and additionally in other meetings and presentations that FDA has conducted, they've stated that when they first start looking at intentional adulteration, they're going to be looking at it just like they did for all the other FSMA regulations, as they're going to educate before they regulate. What that means is as they're looking at the regulatory requirements, if they see potential gaps in your systems, they're going to educate you on ways that you can bring your plan up to what is regulatory requirements. Now, FDA has said that what they're planning on doing early on is conducting, adding on to a normal food safety inspection. So if they're coming into your facility to do a routine inspection, and they're going to add an additional maybe 20 minutes time, 30 minutes time to review the intentional adulteration requirements. Their plans are to ask to see your food defense plan and review it. And then they have anywhere from 10 to 20 questions that they're going to be focusing on to help determine if you're meeting regulatory requirements or if you have gaps. So we're going to keep this in mind as we're going through this presentation on what are these questions possibly that FDA may ask, and they have not shared these. They're being very quiet about what these questions are going to be. So I do not know what they are, and as of right now, except FDA, I don't think anybody does. But we can only guess at what these questions might be. And so we're going to keep that in mind as we go through this presentation. So as a reminder, the regulation we're discussing is 21 CFR 121, and it's titled Mitigation Strategies to Protect Food Against Intentional Adulteration. This regulation requires a facility that's required to register with the FDA and is not exempted, and we'll cover the exemptions really quick next, then you must have a food defense plan. The food defense plan will include a vulnerability assessment, and if we identify significant vulnerabilities or an actionable process step, then we're required to develop mitigation strategies. If we have mitigation strategies, they need to be written, and we must have the management components for them, which include food defense monitoring, food defense corrective actions, and food defense verification activities. And all of this needs to be managed and conducted by qualified individuals. Now, exemptions to the rule, you may be required to register with the FDA, but if you fall under USDA regulated products, you are exempted from FDA requirements for those USDA products you produce. If you are considered a very small business, and that definition is different than what is found in the food safety regulation, for food defense, it's a business that generates under $10 million annually for 3 years in a row, to include anything that's on hand or in stock. And you must submit that information to the FDA, and then FDA will respond to you after reviewing it and saying, yes, we agree, you're a very small business, and so you would be exempted from most of the requirements of the food defense plan. If you are a facility that is a warehouse and or distribution center that only holds food and distributes it, then you're exempted from this regulation if it's fully enclosed. The only time that you would not be exempted is if you're handling and shipping bulk liquids. And in FDA's mind, bulk liquids mean large tankers. It does not include totes, drums, or containers. If you're a facility that all you do is relabels, repacks, and the items are not exposed to the environment in that facility, you're exempted. If you meet the definition of a farm, you're exempted. You follow the produce safety rule. If you are a facility that produces alcoholic beverages, and you are required to get a license from the Treasury Department, you're exempted. And if you produce and or distribute animal food or feed for just those products, you're exempted. And of course, if you meet the on-farm manufacturing requirements, such as small egg producers and game meats. Now, the last thing I like to do before we move on to the main presentation is to cover one definition, and that's an actionable process step. When you're conducting a vulnerability assessment on all your processing steps and products, this is what you're really trying to determine if you have. An actionable process step is a point, step, or procedure in a food process where a significant vulnerability exists and at which mitigation strategies can be applied and are essential to significantly minimize or prevent the significant vulnerability. Basically, when you're analyzing a processing step, you're trying to determine if you have any significant vulnerabilities. And FDA defines a significant vulnerability as a vulnerability that, if it is exploited, would be reasonably expected to cause wide-scale public health impact. So here we come to our first poll question before we go into most of the presentation. And the question is, what does the acronym KAT stand for?
Yeah, I've loaded the poll in the sidebar. If you just look there, what does the acronym KAT stand for? Key access target, key activity type, key aggressor target, or key activity target. And hope you can see that, Earl. About 70% key activity type.
Yep.
Followed by key activity target, around 25. 16 key access target, and just 6% key aggressor target. So,
and as we can see here, the correct answer is key activity type.
Very good.
Now, the main reason I brought this up is because we're going to first talk about the vulnerability assessment. Like I mentioned earlier, when FDA does start their inspections in March of 2020, this is probably going to be one of the first things they ask for before they start asking those 10 to 20 questions. They're going to want to see, what does your vulnerability assessment look like? Does it meet what FDA is looking for in its requirements? And did you conduct one on all your products and processing steps? So to understand this a little bit better, there are no specific methodologies on what you need to use to conduct your vulnerability assessment. However, FDA does have draft guidance documents out there that talks about these three that I have listed on the slide. One of them is the key activity type vulnerability assessment. The other one is the 3-element type vulnerability assessment. And the last one is, that they discuss in the draft guidance, is the hybrid methodology. Now, there are many other potential ways to conduct a vulnerability assessment. The key thing to understand here is it needs to meet the requirements that FDA has set forth on what has to be included in a vulnerability assessment. Now, the main thing that has to be captured in a vulnerability assessment is identifying in some way that you've assessed what FDA calls the 3 elements. But first, we're going to focus on the key activity type vulnerability assessment. Now, it's important that in order to conduct a vulnerability assessment, the regulation says that it requires a qualified individual or a food defense qualified individual in developing and conducting or overseeing the development of the vulnerability assessment. Now, this is important to understand that if you're trained and or qualified in the key activity type, then you're good to go. But say, for instance, you don't have the experience and you decided to seek out training, and your training was more on how to conduct a vulnerability assessment using the 3 elements, and it didn't include some understandings on the key activity types, then FDA could challenge you here potentially on how are you considered qualified underneath the KAT vulnerability assessment type. But what this vulnerability assessment requires is you to list in some way every single one of your processing steps, and you compare it to the 4 key activity types that FDA has identified as being high risk. Now, FDA came to this conclusion by conducting numerous vulnerability assessments on facilities that volunteered, as well as ingredients and raw materials from farm to fork. And within these assessments, they identified these 4 key activities as always high risk. And it did not matter the product, it did not matter the type of facility or the equipment, these 4 activities always came out as high risk. So what you're required to do is compare these 4 key activity types to your processing step, and if it meets one of those definitions, then that processing step is considered actionable. Now, the 4 key activity types are liquid storage and handling, staging of secondary ingredients, liquid storage, and bulk liquid receiving and loading, and mixing and blending. Now, on this next slide is just a rough example of what a portion of a key activity type vulnerability assessment may look like. There's no required format on what your vulnerability assessment is required to look at, but this is just an example. As you can see here, this first processing step that this facility decided to assess is bulk dry receiving. So they did a small description of what that processing step requires. They compared it to all 4 key activity types, and since bulk dry receiving does not fit in any of those 4 parameters, they said, no, this is not a key activity type, and so this is not an actionable process step. Now, if you look at the next one, bulk liquid receiving, if they would go through to complete this assessment, it will be identified as a key activity type because that's what it is, bulk liquid receiving and loading. So it would be a key activity type. Their justification would be that this fits a definition of a key activity type, and actionable process step would be listed as yes. Excuse me. Now, if you're going to use what is considered the 3-element vulnerability assessment, then somewhere within the assessment on each processing step, you have to capture the 3 elements, which are the potential public health impact if a contaminant is added, physical access of the processing step, so can someone reach out and touch product, and also the ability to contaminate product at that processing step. And within this consideration, you have to consider that all of this could be done by somebody that's already inside the facility, because either they're required to be there or they're visiting the facility. Now, this is just an example of what it could look like. There's no specific format. FDA also does have templates that are included in the draft guidance that you're allowed to use if you so choose. But this just kind of shows you a place to list your product, your processing step, a way to record your 3 elements that we just talked about, and to determine if overall, if it's an actionable process step and it requires mitigation. Then the last one that is discussed in the draft guidance is the hybrid method. What this really entails is you combine the two types of assessments that we just discussed. First, facilities would utilize the KAT vulnerability assessment methodology to go through and be able to quickly determine if there's any actionable process steps. Then, a facility would go back to where they feel that they could justify, even though it's considered an actionable or a key activity type, that it necessarily does not meet the requirements of an actionable process step. So here, at this specific processing step, they would then use the 3-element methodology to further explain and justify, yes, we know it's a key activity type, but here's why we feel it is not an actionable process step, and thereby not requiring mitigation. So it allows you to basically reevaluate those processing steps that you identified as KATs, but you're pretty sure that doesn't meet that requirement. An example could be something like, maybe I evaluated a liquid storage processing step, and even though this processing step is fully enclosed, there's no access or anything, if I only use the KAT methodology, no matter what, I would have to list that as an actionable process step. However, if I do come back and use this hybrid method and analyze the 3 elements individually for that liquid storage step, I could easily show that accessibility is almost 0 or non-existent because my system is fully enclosed, thereby justifying that, yes, even though it's a KAT, there's no access to product, so there's no actionable process step here. This is just an example. Now, the reason why we talked about these vulnerability assessments is, like I mentioned, this is one of the first things, more than likely, when FDA gets to reviewing your intentional adulteration, they're going to ask, hey, can we see what your vulnerability assessment looks like? And it's important to understand that we make sure that we're compliant with this. So no matter the style of vulnerability assessment you use, you want to make sure you understand what FDA will know, and that's going to be what they're proposing in the draft guidance documents. Now, it is not specifically required to maintain the KAT type vulnerability assessment or the 3-element or the hybrid methodology. You can use anything. There's many other methods of conducting vulnerability assessments out there, such as the Carver plus shock methodology. This is what FDA used to do all of those assessments to help write this regulation. So that's an acceptable methodology. Another potential could be the operational risk management program. You can utilize that type of a framework that's a 6-step cycle to determine risk, identify gaps, and develop controls. The only thing that you would have to do is, if you utilize another method, is just demonstrate and be able to explain when asked how you captured the 3 elements within whatever methodology you utilized and how you justified your decisions. That's one important factor in conducting the vulnerability assessment, is you have to justify your answers, whether you said, yes, this is an actionable process step and needs to be controlled, or no, it's not. It's not. So you have to justify. And then this is where I think FDA could be asking some of those questions. They may ask things like, can you tell me what type of method you use to conduct your vulnerability assessment? Can you demonstrate where you captured the 3 elements? These are some questions or types or phrases I can expect or can guess that FDA may ask to try to determine, how did you do your vulnerability assessment, and does it meet the requirements that FDA set forth in the requirements? Now, the one thing I want to capture before moving on is, if you only use the KAT methodology, if that's the one you choose, remember that no matter what, this is the one where you can't justify. If it meets a KAT, it is an actionable process step. There's no justification. You would need to consider utilizing the hybrid methodology on those ones that you feel you could justify. So next, we're going to talk about mitigation strategies. So like I mentioned earlier, the regulation requires qualified individuals to either conduct or develop or oversee the vulnerability assessment development. You need to be considered qualified, and there's many ways you can be considered qualified. You can receive training and education. You can have experience. There's many different ways to be considered qualified. But as we learned early in the food safety regulations, when FDA started doing inspections on the preventative controls rule, FDA determines qualified individuals by interviewing and asking questions. So we can expect questions to help them determine if a qualified individual was the one that oversaw the development of that type of process. So questions such as, how do you consider yourself qualified? Or it could be other questions specifically focused on regulatory requirements, like, so can you tell me what you did in order to conduct this vulnerability assessment? Can you help me understand how you determined if you had an actionable process step within here? These are questions that they might ask individuals that develop the plan to help try to determine how they are considered qualified. Now, on the training side, there's many resources out there that can help you get qualified. One of the main ones, and which is considered the recognized course by FDA, has been developed by the FSPCA, the Food Safety Preventive Controls Alliance. With a partnership of FDA, they develop training to help support people getting qualified in these areas. They have created a 30-minute webinar on just intentional adulteration awareness. They did another 30-minute webinar that covers a general overview of the regulations so that you can get a better understanding. Both of these allow you to get certifications or a certificate of training, and both allows you and does not require a test of any sort. The other one that FDA or FSPCA created is the KAT vulnerability assessment methodology. So it's about 4 hours of training. I think the cost is $159, and it allows you to become, get a certificate of training in the KAT methodology only. The next one that they have is a one-day in-person training on how to conduct a 3-element vulnerability assessment, as well as the hybrid methodology. It's a one-day in-person, and they have lead instructors similar to the PCQI requirements that can teach this course and get you a certificate in training on the 3-element and hybrid methodology. The other one is the FSPCA created a 4-hour presentation on conducting mitigation strategies, developing mitigation strategies. I think it's $169, 4 hours, and gives you that FDQI status for mitigation strategies. And then the last one that just came out in December that was completed is developing the food defense plan and conducting reanalysis. So all of these are FDA recognized courses that could get you certified or certificates of training for these courses. Now, there's many other organizations out there that do food defense training as well. As you're well aware, AIB is one of them. So there are potential courses. But whatever training you do, you want to make sure that at a minimum, it's equivalent to what the FSPCA is teaching, because that's what the rule says. Whatever training and education you get should be equivalent to a recognized course. Now, FDA has said in the draft guidance that their goal is not to come into your facilities and say, hey, let me see all your training certificates for qualified individuals and food defense qualified individuals. They're really going to do that through those questions and assessments. So you want to make sure that if you are getting those types of trainings or wherever you're getting your training from, you do understand the requirements, because FDA's questions will be focused around your understanding of what the regulation is asking for. Now, when it comes to mitigation strategies, it does require a qualified individual to develop them, and you're going to need to justify in writing how that mitigation strategy will significantly minimize or eliminate that actionable process step that you identified. Now, FDA has stated in the draft guidance that they really expect most facilities to focus on only 2 of those 3 elements. So if you identified your biggest gap on access to product or that processing step, then your mitigation strategy might be focused on access controls of some kind. Or if you're found your gap to be not being able to limit the ability to contaminate, in other words, maybe a processing step is isolated, there's not a lot of oversight here, or it's in an area that's hard to see when supervisory rounds are being made, things like that, then your mitigation strategy might be focused around increasing or decreasing basically the ability to contaminate product at that processing step. They really don't feel that you're going to focus any mitigation strategies on the third element, which is public health impact if a contaminant were added. Because basically, if you did focus it around this one, FDA sees the only way to really do that is reducing your serving sizes, and they understand that's unrealistic for a business to do. So they really know that most facilities are going to focus on those 2 elements. So they're expecting to see, things like seals or locks or key cards or codes, or even the use of CCTV to monitor. Could also be identifiers such as colors, meaning that maybe certain people in sensitive areas can only wear a certain colored uniform, and that's what's being checked on. It also could be visitors logs or access code rosters to determine that only authorized people are going into areas. And it also could involve inspections, audits, and even training. So I know some facilities are developing mitigation strategies that help focus on making sure that areas are secured as they're supposed to be. So that's an example of an inspection in a mitigation strategy. And overall, your audits can help you to determine if you're overall compliant with your food defense plan that you've put together. And training is an important key, as we've been discussing so far throughout. There are many levels of there are several levels of qualified individuals. We've already talked about the people that conduct the vulnerability assessment and develop mitigation strategies. The other FDQI, or food defense qualified individual, that FDA has identified is the one that develops or oversees the reanalysis of the food defense plan. They need to be considered a food defense qualified individual for that task. Now, this does not mean that you have to have 3 separate FDQIs. One person can be trained on all of those, or several people can be trained on all of those. It's just that whoever is responsible for it needs to be considered qualified. The other qualifier is that supervisors or managers need to be qualified for their roles and responsibilities within this program, as well as employees that are going to be conducting the monitoring of the mitigation strategies. And then everybody in the facility, employees, needs to be trained on basic food defense principles, which could be nothing more than see something, say something type of training. Now, there are many resources out there that you can use to help develop these mitigation strategies, and one of them is the FDA Mitigation Strategies database. I mention it because when FDA comes in and they start asking questions about mitigation strategies, they already have a lot of them mentioned in this database. So if they see something new, or maybe that's not included, they may ask questions on that one to help determine if it's still meeting the requirements of a mitigation strategy. It doesn't mean that what you've done is wrong, because the Mitigation Strategies database, those suggestions in there, that's all they are, is suggestions. You're not required to use any of them or some of them. It's just an option or a useful tool. USDA also has a useful mitigation strategies database, and the CDC also has a lot of listings of potential case studies for intentional adulteration contamination events. You can also reach out to your trade associations, because I know they've been well active in the development of the IA and the town hall meetings that the FDA has proposed, and providing feedback to the FDA during this whole process. And then also the use of subject matter experts and even others that have a lot of knowledge about food defense. These also can be great resources for helping to determine and develop mitigation strategies. So here's our next poll question. And it is, what is the regulatory requirement for conducting food defense verification activities?
Yes, I've loaded that, Earl. Question, what is the regulatory requirement for conducting food defense verification activities? The choices are 7 working days, daily, reasonable time frame, and monthly. And so far, around 60% reasonable time frame, 27 working days, and 15 daily, 11% monthly.
Excellent. So the as you can see here, the regulatory answer is reasonable time frame. A lot of individuals get confused on this because I understand in the industry, most of you out there are probably PCQIs already that help develop or are responsible for maintaining the food safety plan. And within that, verification activities for reviewing monitoring documents and corrective action documents, it states 7 working days. But for food defense or the intentional adulteration regulation, for food defense verification activities, it states within a reasonable time frame. So you get to pick what that reasonable time frame is. However, it's suggested that you include that in your food defense verification written procedure. So that if you're saying that this mitigation strategy is conducted monthly and you feel that verification should be maybe every 20 or every 35 days, there's nothing wrong with this. That kind of meets the reasonable time frame. But it should be included into your program so that when FDA is reviewing it, or if they ask questions, okay, so what is a reasonable time frame for this mitigation strategy? You can demonstrate or say, as you can see here in my written procedure, my verification activity time frame for this mitigation strategy is 35 days, or quarterly, or whatever you have decided in your plan. Now, I brought this up as a poll question because remember that I said if you have mitigation strategies, then you must have the management components, which is food defense monitoring, food defense corrective actions, and food defense verification activities. You need to have written procedures for these, and there's no specific requirement on what the written procedure looks like. Like, it doesn't necessarily have to be in a written full-blown SOP, although it might be beneficial when it comes to training those individuals responsible to doing it. But you have to have it written somewhere on what's required to be conducted for that event. So for food defense monitoring, you need to have some sort of procedure on what is required for that individual to monitor that mitigation strategy. It could be as simple as, if we're talking about bulk liquid receiving and loading, maybe one of the mitigation strategies might be seal verification. Someone's required to verify that all the seals are intact and that they match what's written on the bill of lading. So you would have a minor procedure written or somewhere written on what that person's expecting to do and how they're to document that check. The regulation also requires that for every mitigation strategy, you have to have a written corrective action procedure ahead of time, kind of like what we've done for food safety on metal detection, where if we have a rejection, or if we're doing the challenge test and our test piece does not set off the metal detector, we stop production, call maintenance, and do all of those tasks. We have to have this ahead of time too for any mitigation strategy we've written for food defense. So you have to have a written procedure on what you would expect to occur if there's a deviation on that mitigation strategy. And then we have to verify everything. So we need to verify that monitoring document was filled out completely. We need to verify that if there was a deviation and corrective actions were performed, that was done. We should verify that people are following the procedure as we've written it to make sure that we're doing everything that we've written in our plan. And there may be other things that we feel we have to verify if we're using any type of special equipment, like maybe access control logs for fob cards and things like that. We may need to verify that those are accurate and working appropriately too. So we need to have all of these things as part of the management components for any mitigation strategy we have. I bring this up again because here is again where I think FDA could ask questions to determine if we're compliant. They might review our vulnerability assessment and ask a few questions about what methodology we used, who was the ones that put it together, how were they considered qualified, and then ask, do you have any mitigation strategies? Great. How did you determine it? Great. Now, since you did determine this as a mitigation strategy, can you explain how you are monitoring this? What would be a corrective action required if there's a deviation? So these are questions that we want to be, that I can feel that they're probably going to ask early on to help determine, are we meeting the requirements? Again, we did talk about training. Food defense qualified individuals, and FDA in the draft guidance kind of focuses on those individuals that develop the vulnerability assessment, develop mitigation strategies, and build and review the food defense plans need to have that specialized training. And again, you can have many people assigned to this role or specifically one person for all. And then we do need to have qualified individuals for managers and supervisors and those conducting monitoring and corrective actions for actionable process steps. And again, all people, all employees need to have that basic food defense training so they can help support the IA requirements. And then we need to review the plan. Now, at a minimum, the entire plan has to be reviewed every 3 years. Now, understand that this is a regulatory requirement. I know a lot of you that are developing these plans for the IA requirement for FDA also follow Gfsi. And yes, Gfsi requires every program to be reviewed annually. So there is a difference between regulatory requirements and Gfsi requirements. So for FDA, or the regulatory requirements, at a minimum of its entirety every 3 years, or when there's a significant change with the process or a mitigation strategy, or we get new information, or we have increased vulnerability at a processing step, or we even get new information, or the last one, or the next to the last one there that you see, whenever a mitigation strategy is not working appropriately, we're required to reanalyze just that mitigation strategy to make sure that we have it under control, and if we need to do anything different so that we don't lose control again. And then last but not least, if FDA tells us we need to do a reanalysis. Like I've mentioned a couple different times, there is draft guidance out there currently. We are still waiting on FDA to complete this draft guidance. They currently have 5 out of 9 chapters completed. Within the 5 that's already there, that came out in March of 2019, FDA did include some new information in it. One of them was assessing public health impact, and also overall risk ratings for all 3 elements. So within the included information in the draft guidance, FDA further clarified by providing a rough scoring matrix for each of the 3 elements. If you want to use it, you're not required to. And within that, they also discussed how to assess public health impact. They provided 3 potential ways to do it, but these are not the only 3 ways. One of them was calculating volume of food at risk. They provide a very simplified formula that you can use that basically helps determine that raw material that you're looking at or that processing step, what would be the volume of food affected for public health impact if somebody did add a contaminant. And so based on your calculations, you can look at the risk rating chart for public health impact, and it can help you with the risk rating score to determine if it's an actionable process step or not. The second methodology that was included was using a representative contaminant. So this is a little bit more complicated formula, but overall, when you utilize it, FDA has done a lot of research, and they basically provide a contaminant that would kill 50% of the personnel if this contaminant were added. They did a lot of research before they came up with this 50%. They took attributes from many potential different types of contaminants and kind of threw them all into one. And so that's why this LD50 is a great representative. One of the better things when using this methodology is there's a calculation at the end that can help you determine how much of this, quote, contaminant would be needed to get that 50% kill rate. So it can help you calculate things a little bit better to maybe say you deal with a lot of liquid. When you're using this formula, you may find out that you need a lot of contaminant to get that 50% kill rate. So maybe, you know, 2 55-gallon drums. Well, this would probably make it unrealistic for someone to drag 2 55-gallon drums up a ladder to this big giant bulk liquid storage tank to dump in. So it helps with that identifying potential risk there. But this is the only one that allows you to do that. So if you're going to use the calculating volume of food at risk, the little bit more simplified process, you don't get that end calculation on how much of a contaminant would be needed. The last one that they discuss in the draft guidance is performing a contaminant-specific analysis, meaning FDA says that if you have the expertise, there's nothing wrong with your company actually doing testing or calculating how much of each individual contaminant would be needed to create that event. But FDA says this last one is very unrealistic because it would require a lot of calculating, and some of the information for some contaminants are classified, so you might not have all the information needed. But for those that have that access and ability, it is an acceptable method to assess public health impact. I bring this up because it's really important to understand that if you use like a methodology that included the 3 elements, this is where, again, another question could come on how did you calculate public health impact? And so understanding what is in FDA's draft guidance and being able to speak on it to compare how you did it if it's different. And remember, you can do it differently, but this is where FDA would really probably ask questions to help understand, did you meet the requirements that they set forth within the regulation? But as we can see, calculating volume of food at risk, you don't need to examine specific contaminant characteristics. You're really evaluating, it helps to evaluate batch type processes. It's a time factored analysis, and you can also use it on continuous flow processes, and there is a formula and template that's provided in the guidance document. For the representative contaminant, they created a, quote, representative contaminant that has a 50% kill rate. It basically utilizes contaminants that are easy to acquisition. It also gives a higher specificity compared to the volume of product. And like I said, lethal dose rate is 50% and allows you to calculate that amount needed to achieve that 50% within this formula and review. And again, FDA has provided a template and forms in the draft guidance if you want to use this methodology. And then the specific analysis, it's difficult and it is resource intensive. There's limited information, some of it's classified, so you can't get a hold of it unless you have that type of access. And it also requires you to remain up to date. So if you're doing the specific contaminant analysis, and we all know science changes, this may require somebody to go back and recalculate if there's new information that comes out. So it's really one of the more difficult ones to do. But again, I wanted to share this because, again, this is probably where a question could come from the FDA saying, hey, so how did you calculate public health impact? How did you determine what would be required in order to consider if this is actionable or not? The last thing that you may or may not be aware of is just late in October, FDA released version, the Food Defense Plan Builder version 2.0. Sorry, it was released in October or September, and it was demonstrated by FDA in an October town hall meeting. It allows you to do the vulnerability assessments, and it allows you to do the calculations that we just talked about. It ties in the Mitigation Strategies database, and there even is a webinar that's been updated that includes all the changes. So I just wanted to share, I know there's always lots of questions when we do trainings and sessions, is I know FDA has a Food Defense Plan Builder, does it meet those requirements? Well, up until the one that was released in September, the answer would have been no. But now with the Food Defense Plan Builder 2.0, it does meet FDA's requirements. So this is a potential tool you could use to demonstrate compliance. Now, like we mentioned, FDA stated that they're coming in March. So we know that this is going to be 2 months away. And they have stated several times that they are going to educate before they regulate. They're going to ask to review your food defense plan. So in order to make sure you're prepared, you want to make sure that the people that are going to be handling the audit and that are considered qualified in food defense are present for when FDA reviews the plan. That person needs to have familiarity with the food defense plan and where to find information so that when FDA asks questions, you can bring it up. What I have seen as best practices in the industry right now is those that are really educated and have knowledge about this, their food defense plan already has answers to questions already built in. In other words, some plans I've seen, if FDA would ask a question, I see here you call this processing step actionable. Can you explain why? And they're able to go over to their justification table and just basically verbatim say, well, as you can see, my justification is 1, 2, 3, 4. Wow, that's pretty simple. So if FDA is going to be asking just 10 to 20 questions, and we already have it written into our vulnerability assessment and food defense plan, we may make that type of activity very easy. Again, questions are going to be based on the requirements early on. Now, I mentioned that FSPCA has a lot of those trainings. I've actually gone through all of the trainings. I'm in the process of completing the last one. But I did get my certificate to teach the lead, or am a lead instructor on the 3-element and hybrid methodology course. I'm highlighting this because interviews. In that course, which happened to be taught by FDA, in order to get that lead instructor, they had to ask a lot of questions to ensure that those instructors understood the regulatory requirements. Now, don't get me wrong, I didn't have any specific food defense plans or work for a facility. I was trying to get my certificate to be able to teach the course, but they asked a lot of questions that were focused on the regulatory requirements. I have a feeling that the questions are going to be based on things like that. So if your team that is going to be present during the inspection, or where FDA may go to maybe view a mitigation strategy, if that's what they choose to do during these inspections, those people need to have an understanding of that process and be able to answer basic questions. You also should be potentially prepared, and maybe not in March, but could, for interviews. FDA may want to talk to a few people to help determine if they are considered qualified and they're following the requirements that you put out in the plan. They may also determine to do observations, in other words, ask to go observe a mitigation strategy being completed. The last one there is challenges. And what I mean by challenges is if FDA asks a question and a facility's response is disjointed or not clear, or if it doesn't seem in that FDA investigator's eyes to meet regulatory requirements, FDA may challenge or further ask questions to help determine if it really does meet regulatory requirements. Now, the challenges are really going to probably come early on if we did something that's outside of the draft guidance, or to help them determine if it still meets regulatory requirements. And again, like I said, the draft guidance is only there for just guidance. You don't have to use anything in there, but that's what FDA is going to be trained on more than likely early on. So they're just going to try to use that as a guide to help determine if your facility is compliant with the regulatory requirements. So as an example, if you chose not to use any of those 3 options in the draft guidance to do the vulnerability assessment, you're still okay. Say you chose a HACCP style assessment. FDA is just probably going to challenge a little bit more or ask more questions to help determine how you met the regulatory requirements. how did you capture the 3 elements? Oh, okay, you explain that. I understand. We're good here. So when you looked at public health impact, how did you calculate or determine your risk here? Oh, okay, you used this. Okay, great. So these are where those questions and or challenges are going to come from more than likely early on. So those individuals that are doing, going to be handling these inspections need to have a really good understanding of the food defense plan that you guys have at your facilities and be able to speak on it or talk on it when asked and or challenged. So during this presentation, we did discuss the overview of the IA regulation. We talked a little bit about the methodologies for doing the vulnerability assessments and questions that could be focused on that from these early on inspections. We did discuss potential mitigation strategies and what the requirements are for mitigation strategies and qualified individuals. And we did talk about the draft guidance for IA and a little bit about the food defense plan builder and then questions that may be asked from FDA early on in March. I want to thank you for attending, and I really appreciate you all taking time out of your busy schedules to participate in this webinar, and I just leave it up to any questions anybody may have.
Okay, thanks very much, Earl. That was great. Now we've only got 3 minutes left, but in saying that, we normally stick to an hour, but you know, it's an important topic and we have got a lot of questions. Are you okay for 10, 15 minutes, Earl?
I sure am.
Right, well, let's just see how far we get then. If anybody has to go, if you've allocated an hour, you can pick up on the recording and we'll send it afterwards. You won't miss anything. But for those of you who can stick around, let's get into it. So Heidi, for clarity, would a pet food treat manufacturing facility in Canada be required to have a food defense plan if we ship, distribute, sell our products to the US?
So anything dealing with animal feed, food, or pet food or feed, this is exempted from the IA requirements. So from FDA's requirements, you would not have to have a food defense plan or so forth. Now, it doesn't necessarily exempt you from any GFSI requirements or customer requirements, but from FDA's perspective, it's not expected.
Okay, and Narangachai, can you please explain what the qualifications of FDQI are?
Yeah. So food defense qualified individuals is a term that was added in the draft guidance. Early on in the regulatory requirements, it just says that in order for so whoever conducts the vulnerability assessment has to be considered qualified. Whoever develops mitigation strategies has to be qualified, and whoever reanalyzes or develops the food defense plan has to be qualified. Now, within that definition, FDA says in order to be considered qualified, you must have the training, experience, or education or combination of those things to be considered qualified. And all of that has to be equivalent to what FDA recognizes as a qualified individual, which means those trainings that are provided by FSPCA. But in further discussing this and many other options, FDA says that in reality, again, they're not going to be coming into a facility and saying, hey, show me that FSPCA certificate or whatever. They're going to just be asking questions and reviewing your plan. And if you have the majority of the requirements, then you must be qualified. But if you can't explain the requirements or your plan doesn't meet requirements and FDA can't figure out how, they're not even going to care what you can show them as training. Say you do have an FSPCA certificate, well, you must not have paid attention to the requirements because you missed a lot of stuff in your plan. So FDA is not going to consider you qualified, if that makes sense.
Yeah. So it's about competence.
It really is.
Demonstrated by the plan. Mario, the Food Defense Plan Builder software available in FDA site, which methodology fits in?
So the 3 that I mentioned in the presentation is included. So you could choose to do the KAT, you could choose to do the 3 element, or you can also choose to do the hybrid methodology if you want to in here.
Okay, and Sherry, let me just pick that one up. Sherry, oh, it's not working. Oh, there we go. As an importer, how do sorry, how do we prepare? As an importer, how do we prepare our foreign suppliers to be compliant with intentional adulteration rule? Does the foreign supplier need to have an FDQI on site?
So from the Foreign Supplier Verification Program, it does not tie into IA. And the reason is because the intentional adulteration, the vulnerability assessment, and these things are secretive to the facility. Remember that when you're doing this, you're trying to prevent an insider from doing these bad things. So FDA doesn't expect the importer to follow up on this. However, it's encouraged that that importer have knowledge about what food defense is, so that when they are working with their supplier, if their foreign supplier is struggling, then they can help educate them on the requirements and help them build their plan if they need to.
Okay, and Sue, there's something with highlighting them in the sidebar, it's not working, but Sue, would the FDA Food Defense Plan Builder 2 be enough of a vulnerability assessment?
It depends upon your company profile, but yes, it is. It has everything in there that you need as a, quote, one-stop shop to meet the requirements of IA. And also, even for those facilities that aren't required to comply, it's a great tool to conduct a vulnerability assessment and to determine potential gaps in our systems, especially in the way that FDA is looking at it, if that makes sense.
Okay, and Javier, sorry, not Javier, Jasquisha. Is PCQI different from FDQI?
So it's similar, but definitely different. So PCQI, you get all that training and education, or you're considered qualified because it's food safety related, meaning that it's focused on accidental food safety, things. For FDQI, when you're doing this whole program, you're reviewing things in an intentional aspect, not food safety. So it's a different mentality when you're doing your assessments. You're not thinking, wow, how could someone, if they don't clean this table, accidentally contaminate product? It's how could someone on purpose do something bad here to hurt a lot of people? Yeah. So that's why the training is quite different.
Okay, and Narangchai, could you explain the corrective action when the APS is deviated, e.g. unlocked tank found, how to deal with product suspected?
Okay, I think I know what's being asked here. So FDA has a lot of information that they put into the preamble of the regulation. So 21 CFR 121, the full regulatory requirement is like 200 and some pages long. But the first 100 and some pages is nothing more than comments and responses from the industry when FDA first proposed a regulation. FDA calls this their first guidance document. Within here, they did talk about corrective actions for food defense. They say that they're expecting them to be simple and flexible. There's no requirement for anything, and there's honestly, depending upon what you include in your procedure, there may not be a requirement to even evaluate product. FDA considers early on that in a lot of cases, deviations in mitigation strategies are not really going to be based on someone contaminated product on purpose, but our associates or employees didn't follow the procedure appropriately. And I'll use that example that that the student proposed online. So let's say I have a bulk liquid storage room and I have one door that goes into it, and I'm going to use a padlock, and I'm going to have a key procedure to get that key. One of the things I'm probably going to monitor is making sure that that access roster is always updated so only those authorized can sign out that key. And the second one's probably going to be at some frequency, I need to come by and check to make sure that lock's in place and the door is secured. So if today I'm coming by and the door is wide open and nobody's around, that would be a deviation from my mitigation strategy. So I would need to implement some type of corrective action. So if I go into my door and there's 4 tanks, and am I going to assume that all of this product is contaminated? Would FDA expect me to put all this product on hold, send samples to labs to be tested for any potential contaminant I can think of? This is not necessarily the case. FDA wants you to do your due diligence, so you would go in and assess. Maybe you walk in and make sure nobody's in the area. If you're lucky, and maybe even if it's not tied to a mitigation, maybe you have a camera in here. So maybe you go review footage to see who was the last person in the room, and you notice that nobody came to the tops of the tanks. So here, you know your product's still safe, but now you need to focus on a corrective action on making sure that that door is going to get locked again like it's supposed to. So that's where your focus would be, on that corrective action.
Okay, clear. Attil, as an exporter from Turkey, is it a must to train transporters and drivers about food defense with respect to FSMA?
So it is encouraged that people in the facility understand basic food defense requirements. And more than likely, transporters and drivers probably already understand this. They're probably already trained on making sure that the truck is locked and or sealed before they leave it, not leaving it unsecured and walking away, and those kind of things. It's not going to be expected that they have any training more than this.
Okay, and Rick, can the training for some of these trainings be done in-house if there is a test involved to prove competency?
And FDA doesn't even require a test to prove competency. This is the biggest difference between Gfsi and FDA requirements. An individual can be considered qualified just through experience alone. As an example, many of you may know my history or not, but prior to joining AIB, I served 23 years in the U.S. Army as a military food inspector, where we do a lot of these types of things for the military's food defense programs. So I could potentially demonstrate that through all my experiences of conducting all of these vulnerability assessments, I'm already qualified. That's not how I consider myself qualified, but I could potentially use something like that. FDA has not prescribed that you have to use FSPCA's training either. So if someone has experience and puts together internal training for the company, as long as it covers the requirements, that's just fine.
Okay, and Rachel, please confirm you said that FDA will assess FDP with regular audits when they begin assessing IA compliance in March 2020.
Yes, but it's going to be a second part of it. So meaning that if they come in and do a food safety inspection or a GMP inspection, at the end of it is when they're going to say, okay, now let's go ahead and take a look at your food defense plan and do those additional 10, 20 questions to determine compliance. But if they're there going for a important issue, like say a for-cause type inspection, or if they're there for recalls or things like that, it's not expected that they're going to look at IA. It's going to be just at a normal routine type inspections. Now, it's also only going to be done by compliance dates. So those of you that were required to comply on July 26th of 2019, when they come in March of 2020, that's who they're going to be doing this for first. But unfortunately, the smaller businesses, those that have under 500 full-time employees, your compliance date is July of this year. So we'll have about 2 or 3 months of these inspections before you're required to be looked at. So that's where those are the two groups that really need to be worried this year.
Right, and that answers the next question actually. Linus, are FDA audits food defense being scheduled by size of each company? Yeah, so they are. You've just confirmed that. Will this webinar be online, Barry? Yes, we'll be issuing the recording by email later with the slides. I did see an interesting question actually from Shiva. What is the factor for determining reasonable time frame? What is a reasonable time frame?
This is going to be up to you and your facility and how you write it up in your procedure. Again, FDA is going to challenge anything that seems overly long. I could see a potential challenge, and remember, this is only potential. I'm not FDA, but say my mitigation strategy is to ensure this door is locked. I might, and maybe I'm using the electronic fob cards. So for the fob card access, I might only check that quarterly. because I know I have a good program in place. My prerequisite program's solid. I've never had any problems with fob cards or anything like that. So my first monitoring event might be quarterly. I'm going to review and make sure that only those that are authorized entered that room. The other one, though, might be making sure the door is still secured when somebody's not entering in those things. If I say that I'm only going to check to make sure that door is locked once a quarter, that could be where FDA challenges a little bit and says, how do you think that only checking to make sure that door is locked quarterly is enough to make sure that that's being followed? But again, if you have a great way to justify it, could be that, you know, I've been doing self-inspections for my facility for 5 years, and we've never had an unsecured door problem, you know? And so that's why I determined quarterly. If you can justify that to the FDA, they're probably going to like, okay, makes sense, let's move on. But they've been in many facilities just like you guys have, and they know that they always find doors propped open and those kind of things, if that makes sense. But again, yeah.
If you check 3 months and then on the physical audit they go and find one open, then whoops.
Yeah. So you just want to be realistic in choosing your verification activities and your monitoring events.
Okay. Rokshanara, do we require food defense program if we are a small facility, less than 10 million annual sales?
So if it is less than 10 million annual sales for 3 years in a row, it's important to understand that you do have to submit this to FDA and get a reply back to them confirming that you are considered a very small business. Once you get that, then you're going to be exempted from the IA requirements, but you're still going to have to attest to the FDA that in some form you have a food defense plan.
Yeah.
And every year, you're going to have to resubmit that financial because it's for 3 years in a row. But yes, if you meet those requirements, you're exempted.
Okay. And Diana, any recommendations for evaluating food defense plans in food packaging?
So that's a good question. And that's one of the facilities that would be exempted because they're not required to register with the FDA. So, but I can tell you that from AIB's perspective, we do offer food defense training, and almost in every training session, we have industry members from packaging facilities. Now, they know they don't have to comply with the regulation, but they know that their customers are still going to ask them about information because they have to comply. Yeah. So it's really important that they understand the requirements, but they're, from a regulatory standpoint, not required to follow the IA rule.
Okay, and James, as an exempt pet food manufacturer, do we still need to ask FDA for the exemption?
No, on this one, you're not going to be required, and they already know this. So when they come into your facility to do a normal GMP inspection on the animal food requirements, they already know that it has nothing to do with IA, so they're not going to ask.
Okay, Kelly, when we consider our sales for how we might be categorized in size, very small, small, large, etc., does our raw goods inventory count or just sales?
So it's everything involved whatsoever. And as an example, with that 10 million, it's not facility specific, it's company. So I'm not going to use a food company as an example. I'm going to use Disney World. So we all know that Disney World has about 5 or 6 different amusement parks around the world. So even though, let's say, Disneyland in Florida would need to have a food defense plan, when they go to calculate what their business size is, it's all their amusement parks, not just that facility. So when we look at our business size, it's all companies and all subsidiaries in that calculation.
Okay. Thanks. Jason, does AIB have the ability to share common mitigation strategies they're seeing in the field that firms are leveraging to reduce vulnerabilities? Are a majority of them personnel-based versus technology-based? Thanks, Ale, for a great presentation.
Yeah, so we do have that capability. We do a lot of assistance with the industry on trainings and education, and in those courses, a lot of people share what they're doing at their facilities as examples. They don't go into too much detail. Additionally, though, we do help go in facilities with theirs, and so we do get a chance to see what a lot of people are doing in the industry. And yes, Right now, what we're seeing as for most facilities doing on mitigation strategies is access control and personnel monitoring type things. But yeah, we do have that capability.
Okay, and Alexandra, is the beer industry required by FDA to have a food defense plan?
So if they're required to get a license from the Treasury Department as a continuation of doing business in the United States, they're exempted.
Okay, and Mickey, will FDA go and inspect overseas manufacturing for food defense plants?
So they're going to, because any facility that's required to register, whether in the United States or outside, when their compliance date hits, is required to have an IA food defense plan. But whether FDA is going to focus overseas first or in the United States first, nobody knows. So my best advice could be to you is when your compliance date hits, make sure your plan's in place and running, and just be prepared.
Okay, Mario, what is the best way to verify the intentional adulteration if in a company there are no cameras?
Verification does not necessarily have to be by viewing cameras. For instance, what I have seen some companies do is on the verifying that a procedure is being followed, they add a couple of spots to their monthly self-inspections and then record down what mitigation strategy they observed or whatever they observed, and that's a verification activity. Another thing that I have seen facilities do is at a certain frequency written in their plan, facilities are required to verify that procedure occur without that person knowing that they're there type thing. So there's just many different ways that you can do it. You just have to make sure that it's following whatever procedure you've written down.
Okay, I've just put the certificate of attendance in the sidebar, but are you all right to carry on see if we can make it to the finish, Earl?
Yeah, sure.
Okay. Henry, are the potential health impacts required to reflect on the food defense plan?
You're going to have to be able to justify how you determined your overall rating for public health impact. Early on, before FDA added this update in March of 2019, there was not a lot of information on how FDA might look at this because they didn't even have how to calculate it themselves. So you can just expect that if you didn't use FDA's methods, be able to explain how you calculated it and determined your risk levels.
Okay, and Robert, we are a food distributor. Do we have to have a food defense program?
So as a food distributor, if your products are fully enclosed, like say canned green beans or frozen chicken in a box, no. If you handle bulk liquids, and I'm talking large storage units, not 55-gallon drums, not totes, then yes, you're required to have a food defense plan. If you have exposed product, then you're required to have a food defense plan.
Okay, very good. Ethan, please explain about vulnerability assessment that is common to TACCIP and VASSIP.
Okay, so TACCIP is basically the IA. And so it's basically the same thing. However, TACCIP, as explained in the Gfsi requirements, and what you're required to do, like say BRC, SQF, and FSSC, most of them only say you have to do a vulnerability assessment and if needed, develop mitigation strategies, and that's it. FDA's requirements for IA are really prescriptive and much different. So they are two different things.
Okay. Carrie, have you just answered this one, Earl? Will the March 2020 inspections include foreign FDA registered facilities as well?
Yes, yes.
Yeah, you did. And Drew, how will this work with CBD/hemp products? I assume the same as typical food and beverage industry.
So if you are required to register with FDA, you're going to have to fill in with this too.
Right. Raina, should a company that has building in 2 different states have one food defense plan or one for each company in each state?
So the food defense plan, just like the food safety plan, is required to be specific to each facility. So if your facilities are identical, your plans might be identical. But in reality, FDA, even if your facilities are identical in 2 different states, the personnel are different and maybe the way things are done are different. So that's why FDA is saying it's supposed to be specific to each facility.
Okay. And Victor, what do you recommend to train staff in food defense?
First and foremost, you should definitely do what's important to the company and do general food defense awareness training for everyone. What we propose at AIB is develop your training in 4 levels, and no matter what FSMA regulation we're talking about, you should be compliant on qualified individuals. So the first level is you're going to have that level that's in charge of your program. So for food safety, we call it the PCQI. For food defense, we're calling it the FDQI. So you want that person with the ultimate knowledge on the IA regulation to lead your program. The second level is supervisors and managers need to have a little bit higher training than everybody else. They need to be trained on any mitigation strategy that they're required to supervise and any other role that they may be required to fill, which in most cases is probably going to be verification and corrective actions. So they need to be trained on those kind of things. And if you have in your food defense policies and procedures, things such as when you're training your employees and you say, if you see something really weird, come and report it to any manager, you need to train those managers on what they're required to do if an employee comes to them and says, hey, I saw somebody contaminate product. The third level is the person doing the job. So if I'm the one required to do the seal checks, or if I'm the one required to do that door check, I need to be qualified on how to do that. And then, of course, like I said, everybody has to have food defense awareness. If you do those 4 levels of training, you should meet any FDA program requirement.
Okay, very good. Sudhir, as an importer, are we required to review and document our suppliers' food defense plans?
So that's not a required element in the FSVP program. IA rule was taken out, like I mentioned earlier, because these plans are very sensitive.
Okay, and Perla, I hope this makes sense to you. Are exposed product suck as ready-to-eat commodities in bulk, fruits and vegetables exempt?
Exempt. I think I understand. So if you're like a warehouse and distribution center and you have a lot of produce, you know, and sometimes the produce comes in the, like bananas, for instance, right? Comes in banana boxes with holes in it. In that aspect, it's not fully enclosed. It's open and exposed to the environment. Are they required to develop anything? It just depends on your analysis. You would require to do an analysis, but you might come to the conclusion that a banana cannot be just consumed like eating the peel itself. You have to peel it and so forth and so on. And so thereby there might not be no risk, but you still would be required to do a vulnerability assessment at the minimum.
Okay, right. Everybody who's left, the 296 people, can you give Earl a round of applause in the sidebar, please? Because 1 hour, 23 minutes. We've gone over a little bit, Earl, but you've answered lots of questions, and that's what we're here for. You've imparted a lot of knowledge and answered lots of questions. And you've been a little bit poorly as well, haven't you? You've been a bit under the weather.
Yeah, I'm just recovering from the flu.
Yeah, so you deserve a nice lie down and then maybe a glass of something later. Okay. All right, Earl. It's been a pleasure working with you again and Aib International, and enjoyed it. We will be seeing you later in the year. What subject are you doing later in the year?
We're going to be covering food fraud and food fraud mitigation strategies.
Brilliant. Another well-worthy topic. So thanks very much, Earl. I'll speak to you soon. Have a nice weekend.
Thank you, everybody.
Okay. Yeah. Thanks to Earl there, and thanks for sticking along there. I have put the certificate in the sidebar that you can download. Give us an hour or so, and we will send the follow-up email with the recording, the slides, and the certificate of attendance. I'll put AIB's link in there, so if you do have further questions, you'll be able to head over to their website and ask away. So thanks very much. We'll be back next Friday. Watch out for our emails. Enjoy the rest of your Friday. Have a fantastic weekend, and we'll see you on the next one. Take care, everyone. Bye.